There are still many questions about President Trump's medical condition and treatment related to his COVID-19 infection. We know the president received a positive test result Thursday. Physicians at Walter Reed Medical Center announced earlier the president would return to the White House Monday evening.
Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal.
Dr. Shoshana Ungerleider joins me now. She's an internal medicine physician at California Pacific Medical Center. Doctor, thank you so much for joining us. Given what we know about COVID-19, what do you make of the decision to release a patient from the hospital so soon after admission?
Well, from a medical perspective, it's extremely surprising to me at this point that President Trump will be departing Walter Reed Medical Center tonight. So, during his stay, he was given remdesivir and an experimental antibody cocktail and dexamethasone, which is reserved for severely ill patients, typically with COVID. So this means he was sick enough to necessitate this type of therapy. So there are many questions that remain. It sounds as though back at the White House, they have high quality medical care. But then why did he necessitate medical transfer to Walter Reed in the first place? I will say that based on the comments from Dr. Conley today, we can surmise that the president's kidney function was actually not good at one point. And given that he had a few low oxygen events and they won't comment on his chest imaging results, his lung function is potentially impaired. So all this is very concerning.
So when asked about the last time the president tested negative for the virus, White House Dr. Sean Conley had this to say. Let's listen.
HIPAA kind of precludes me from going into too much depth and things that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry.
So I wonder, Doctor, what your thoughts are on HIPAA rules applying to the President of the United States.
Well, it's a great question. And of course, it's a little bit of a gray area, given this is really unprecedented territory. I do find it strange from a medical perspective that they won't disclose the date of his last negative COVID test or whether or not he plans to isolate, because it's clear the White House has become this COVID hotspot. And let's not forget, there's hundreds of employees at the White House who are essential workers. They work in facilities or on the grounds, the Secret Service, who serve our country. They'll be in harm's way if the president doesn't take appropriate infection control measures like isolating. And additionally, I just have to say, for the president to tweet that COVID is not a big deal in the face of more new daily cases in the U.S. today than in the last 2 months, we're absolutely going the wrong direction here as we head into flu season. This virus has killed 209,000 Americans and required him to be hospitalized for 3 days. So for him to downplay this virus is a blatant lie that will only lead to more lives lost in this country.
So let me ask you about something else that Dr. Conley said. He previously said that 7 to 10 days after infection is when the virus can enter phase 2. Doctor, what does that mean?
Well, I suspect that he's talking about the period of time in which you're most highly infectious. And so the thinking was, again, we don't know exactly which day he tested positive and exactly when he started beginning exhibiting symptoms. But I believe he's talking about the fact that when the president will no longer be at heightened risk for infecting others.
And what are doctors actually going to be looking for here as the president prepares to return to the White House? I mean, at the very top, doctor, you ticked off what you think may be indications that there may have been some effects on his kidneys, on his lungs. We understand that he had to get that supplemental oxygen and that his pulse ox levels had dropped a couple of times. What does all of that point to? Obviously, none of us has the full medical picture right now, but based on what we know of the progression of COVID-19, what does that all seem to suggest to you?
Well, again, it's a pretty gray picture here. They really have not been forthcoming about all of the details that initially necessitated the medevac transfer to Walter Reed, and then what would have necessitated remdesivir and dexamethasone. This is a steroid medicine that's been around for years. In the UK, they actually studied it in severely ill COVID patients and found a reduction in mortality by a handful of days for patients on ventilators. The bigger issue here that I'm seeing is the president returning back to the White House and the potential side effects of continuing on dexamethasone, which they are stating that he will be on. This medicine is, again, well known, has been used for many, many years, and has psychological side effects like mood swings and memory issues, confusion, manic behavior, which is very troubling given the responsibility of being the president of the United States. So all of this needs to be closely monitored, and they will be watching this in the White House. But based on those side effects, it's very troubling to the medical community.
Well, you raised some really important questions, Dr. Shoshana Ungerleider. Doctor, thank you so much for sharing your expertise and insight with us. Really appreciate it.